Hi everyone, it's Gavin. You're the busy since sand, and you're listening to the Therapy Suite right here on UK Health Radio, the world's #1 talk health radio. This week, I welcome back Dr Gabrielle Pendlebury, Clinical Director of Psychiatric Services, where we'll be discussing neurodiversity, for example, ASD, ADHD, and Tourettes. Welcome back to the show, Dr Pendlebury. How are you doing?
Oh, fabulous. It's really good to be back. Thank you for inviting me to talk about this. Quite an interesting subject, I think.
It is. It needs more awareness, isn't it? About, but before we go there, just remind us a bit about your background.
Gosh, so I'm a child and adolescent psychiatrist, and I specialise in neurodevelopmental disorders. So that's mainly autism, ADHD, Tourette's, but also all those disorders, conditions that you can get in combination. So things like depression, anxiety, OCD. I used to be clinical lead for forensic community services at the Tavistock and Portman NHS. And for 7 years, I was also a medico-legal advisor, so advising hospitals, doctors, local authorities on that interface between medicine and the law. That's me. Do you want to tell us a bit about yourself?
Oh, well, I've been working in local authority now for like 14, 15 years. I've worked in various areas such as mental health, domestic violence, etc. And I'm a radio host. Just to do it all in one go. But thank you very much. I'm wondering who's interviewing here. Interviewing who? Oh, gosh. But thank you very much for that. Look, let's start with, what is neurodiversity?
So I had a look at what I thought was a really good definition, and this one comes from Harvard Medical School, and basically says neurodiversity describes the idea that people experience and interact with the world around them in many different ways. There is no one right way of thinking, learning, and behaving, and differences are not viewed as deficits. So it's that idea that there's this huge spectrum or continuum, and people have like different abilities, and it's affected by the environment, it's affected by their genes, and it's some things they might be very good at, some things they might be not so good at. But the idea is we're all neurodiverse, so we've got strengths, and we might have areas that we're not as good at, but essentially we're all on that continuum.
Right, okay. Very interesting. It's quite broad, isn't it, the definition? It keeps it a bit broad as well.
Yeah, it's trying to say that, it's very inclusive. It's trying to say that, it's fine that you're able to do things that others can't, and vice versa. It's about, the community, the world in general, that all of us make up part of that. And the whole is greater than the sum of the parts. Like we've all got these abilities, and you want to basically fulfill your potential. And when you're thinking about neurodiversity, you're thinking, are there areas that perhaps you need extra support with, or are there other areas that perhaps you can bring extra to perhaps school or your workplace or sport because you have extra abilities because of that?
Of course, yeah. Give us some examples. Let's talk about some conditions. Let's start with ASD. What does that stand for?
So that's autistic spectrum disorder. And that's a neurodevelopmental disorder. So if you think about, I think I've talked about this before, about rules of psychiatry in a sense. And the most famous child psychiatrist, Michael Rutter, said that everything is a gene-environment interaction. And so he would say that the genes load the gun and the environment fires it. So you've sort of got predisposition to things, and then there might be environmental factors that occur that, in a sense, set off that chain of events. And so when you think about neurodevelopmental disorders, they are very genetic. So you have a very genetic predisposition. And so something like autism will affect communication and social interrelatedness. And so you tend to have a triad of difficulties in a way. And so social communication might be difficulties interpreting sort of verbal and non-verbal language, and that might be gestures, understanding if someone's angry from the tone of voice. It may affect their language skills, and it might mean that they're very literal, and so they might not understand abstract concepts or pick up on sort of nuances of the way people interact, such as being sarcastic or things like that. And so that's your social communication, but then there's also social interaction, and that might be difficulty recognizing or understanding others' feelings or expressing their own feelings. So what you see a lot with children with autism is they might have terrible anxiety, but they might not be able to identify that feeling. And it might just be shown by having a meltdown or getting very upset about something, but actually they're having feelings of anxiety that they haven't been able to identify, that are triggering off events. And so the thing about social interaction is these young people might appear insensitive to others by being very direct, or they may find it harder to make friends and things like that. But then also you can have some very positive strengths, that they can be very good at focusing on things. They can be very detail orientated and able to retain facts. So have good high intelligence and also very good analytic skills. And so you have sort of this different approach to life, in a sense, which was what that definition was about, that people can interact differently, they can learn differently, they can behave differently, but it doesn't mean that there's a right way of doing things. It's just a different way.
Can you give us some examples of the symptoms and characteristics of ASD?
It's very broad spectrum, because individuals that do have autism can have language delay. So sometimes they might have difficulties with that, and that might be one way that the parents or school or social workers have picked up the difficulty. You can have an impact on processing speed, on intellect, on memory, but generally depends on the age of the child. So what you tend to find is much younger children would probably have problems with language and problems with relating, whereas you might have children who have less difficulties when they're younger, so that you don't see that they have problems maybe till they start secondary school. So when the world becomes a lot more complex and it's harder to make friends and there's a lot more demands on them, then you might see that they have more difficulties. So it's quite subtle. I'm sort of skating around because there's so many different ways that it can present. That the best thing to do is that if you are concerned, it's to go to your GP. They can do a screening with the parent, and then they can think whether perhaps that child needs a proper diagnostic assessment.
Basically, how does someone make a diagnosis of ASD?
Gosh, so it's quite a detailed diagnosis. There's something called NICE guidelines, which is National Institute of Clinical Excellence, and all parents can have a look at that. But essentially, the first stage is a very good developmental history. And so you'd be talking to the parent and going through in great detail, all the milestones of the child and any difficulties that they had, especially before 36 months. And the second part would be getting information from the school, so getting a collateral history to understand how the child is functioning in school. And then the third part is usually something called the autistic diagnosis observation schedule. And so that's where the practitioner, normally two people, so it's a multidisciplinary team, would observe the child, do lots of tasks with them, and then they will score that against a validated schedule. And so lots of those tests would be things like looking at the child's imagination and seeing how their language is, looking at their eye contact, and seeing how they relate in conversation, and also just thinking about their mental state and observing them generally. So it's a very detailed and quite a lengthy assessment. And from that, you're thinking about a diagnosis, but you're also thinking about where the child is having issues. So which areas that you'd want to focus on in terms of improving child's outcomes, such as social skills, thinking about communication, occupational therapy, and so really be able to target the areas that require support and improvement.
It sounds like it's quite a long process to get a diagnosis. Do you know averagely how long it takes?
So to do all the assessment bits probably only takes about 5 to 6 hours.
Okay.
But the problem is, there's a lot of issues with resources at the moment. So there's very long waiting lists in NHS, and even privately, it might take time to bring it all together. But once you get your appointment, you should be able to get a diagnosis within a couple of weeks. It's just getting to that point.
Okay.
And it's quite hard for parents because it's one of those diagnoses that are very difficult as a parent to deal with. And so lots of times parents might be in denial, or they might be parenting the child so well that they don't see the deficits until the world gets a lot more complicated. And so it's not one of those quick fix things. And the solution generally is providing autism-specific, program, which would look at their education, what's happening at home, and all those areas. So it's one of those diagnoses that people can take a long time to get to the point of wanting their child to be assessed. But it is a very positive thing to do, I think.
Is there quite a long list of people waiting for a diagnosis? I'm guessing there must be a huge list, possibly.
Yeah, I think in the NHS at the moment, it's probably over a year. Some places it could be up to 3 years.
Oh gosh,
yeah, so
that's a long time. Yeah. We're just going to a quick ad break, and we'll be right back.
UK Health Radio, the station that makes you feel good. UK Health Radio, the station that makes you feel good.
So, Dr. Pendlebury, thank you for that, information about ASD. Let's go on to ADHD. What is ADHD?
So ADHD is another developmental condition, and this affects attention, impulsivity, hyperactivity. And so in these young people, you've got 3 subtypes. So the first is predominantly hyperactive, and the second is predominantly inattentive, and the third would be hyperactive and inattentive, so a combined subtype. And basically, those 3 areas can have a huge impact on young person's functioning, both in school and at home. And so it's one of those conditions that having a diagnosis as well can really reframe everything that the young person's doing. And so in some cases, the impulsivity can be seen as naughtiness, and it can really have a huge impact on the young person's self-esteem. And so it's one of those areas where there's lots that can be done to support these children once they've had an accurate diagnostic assessment.
I did actually a show on ADHD a few months ago, and very interesting. And I remember the discussion went on to, because of the impulsivity, people end up carrying out certain acts which get them in trouble. They can end up in prison. and that kind of thing as well. Do you come across anything like that at all?
So because of that impulsivity, ADHD can be associated with, those criminogenic behaviours and also can be associated with substance misuse. There's a higher rate of suicide in individuals with ADHD and things like that. So the point of catching it early in childhood is, that impulsivity might be taking your classmate's pen or doing things like that. So to be able at an early age to say, look, this is a neurodevelopmental disorder, this is the treatment plan, in a sense, you're hoping to change that trajectory so that young people aren't going into late adolescence or into adulthood with the same difficulties, and they're able to do something about it early on. And that generally is with school support, so that they're not sort of ostracized or punished, inappropriately for things that they perhaps can't control.
And I think 100% I agree with you. I think it all starts with the person as they're growing up, and, education being there for them. But then I suppose the other thing is the diagnosis part. How is it usually diagnosed?
So ADHD is a bit simpler than autism, in the sense it's about having, information from the school, the parent, the young person, and that could be standardized questionnaires. And then you bring all that information together, and that information will help the clinician, usually a child psychiatrist, to decide if it's ADHD or if it's ADHD with something else, and to think about what the diagnosis is. And so it's a lot quicker to make that diagnosis. But I would say that these children can be a lot more complicated. And so you picked up on that there might be behaviour issues. And so there might also be anxiety, there might be depression, there might be other things hanging around. So it's important for parents to think holistically and not, in a sense, just presume it's ADHD, to have a full assessment so you can look if there's anything else that's co-occurring.
Can ADHD go undetected, do you think?
Yeah, I think so, and especially in girls, because if you think that the hyperactivity might just be presenting as fidgety or very distractible, it might be a lot subtler. And especially children that are intelligent will learn ways to mask things which are causing difficulties. So lots of people can go through life and not receive that diagnosis. And there's been a huge wave of people now getting diagnoses in adulthood. And so whenever people ask me, as an adult, do you think I've got ADHD? There's certain things you can ask, like if you ask them like how they are, how their brain is, in a sense, they'll often tell you that, they've got like 50 thoughts at the same time, they're always restless. And if you ask them how they were as a child, they'll say like they were always the child that couldn't sit in their seat at school, always being told off, always, doing things. So it does go astray, as it were. Because I remember probably about 10 years ago, suddenly the awareness of bipolar, hit the headlines, and diagnostic services, improved greatly for that. And in a sense, that's what's happening now, I think, with neurodevelopmental disorders, that the awareness means that it's much easier to get a diagnosis, and there's evidence-based treatments. And so it's one of those areas that, I would say it's always worth looking into. There's two schools of thought when it comes to diagnosis. And one is that, you need a diagnosis to get an evidence-based treatment, because we do lots of research, so you understand what's the best treatment. But the other school of thought, sort of a more psychoanalytic approach, would be that you don't want to label people. You don't want to, in a sense, put them in a box. You want to understand them. And so giving them a diagnosis might constrict things. But in terms of children and neurodevelopmental disorders, it's very hard to get what you need from school and those around you if everybody doesn't understand, exactly what the problem is. And so I would always go for the diagnostic approach, I'd say.
No, of course. Tourette's syndrome. Let's talk about that for a minute. I mean, what is that and how does that present usually?
So Tourette's tends to be a mixture of sort of motor and vocal tics. And so you may have seen, I think there was someone a few years ago who one Big Brother who had Tourette's. And so that it's that involuntary movements, which might be, a movement to the head, or it might be, a complex movement. But it's involuntary motor movement. But then you also have tics as well, which might be, saying words, vocal coughing or making noises. And so it's those coming together over a period of time that we get the diagnosis. The thing about tics in childhood is most of the time that just with psychoeducation for parents and young person, most children don't need treatment for those. They tend to grow out of them. But in some cases, behavioural therapy might be required just because it's having a huge impact on their life or affected school, and it's too severe to allow to be left.
Can the tics be physical as well, or is it only verbal?
Yeah, so verbal and physical. So like a motor tic, so a movement of any part of the body. It could be something simple, or it could be a complex movement, sort of doing, multiple things in a sense.
That must be awful for the person, because they must, when the tics occur, because it's not something you can really control at all. So they must feel really embarrassed, and it must put that person down, when it occurs.
So it really depends, because if you understand what's going on, and especially at school, and advise teachers, classmates, what it is, because I think it's the reaction that others have to that can be distressing for the young person. It's not, the young person is sort of doing something involuntary, and it shouldn't be painful or cause distress. But if they get a negative reaction every time they do it, then it sort of builds up attention. And so really the key is everybody understanding what's going on and how to deal with it, so that they're in a sense not targeted or feel self-conscious when they do have these things.
No, of course. And how is that diagnosed? What's the method?
So again, that's really about the history, so understanding the developmental history. In all of psychiatry, you want to always rule out physical causes for things. And so you want to make sure that there is not an infective cause or other neurological causes. But then it's really about history and observation of the patient, so that then you can think about diagnosis.
When I think of Tourette's, I think of some of the movies we've seen, isn't it? They kind of take a really kind of it's a really kind of intense perspective about someone with Tourette's, like the swearing. They emphasize the swearing, etc. That someone might, they might have no control over what they're saying and might insult people. Is there anything else the tics can involve verbally at all?
It really depends on the individual. So that's probably the extreme. But when you see young children, you might see them like clearing their throat, and basically, having these tics, which are either vocal or motor, which are quite subtle, but you can have more complex tics. So, I've seen films where there's sort of that's elaborated, but essentially it's you can have lots of different presentations. but most of it is quite manageable. And a lot of the key is, as I said, educating those around the young person to support them. But there are treatments as well, forms of behavioural therapy that can be used.
Is CBT one that can be used?
Yeah, so you'd use the behavioural part. So you perhaps leave out the cognitive part, not necessarily, unless there was other reasons for having that. But you can have behavioural therapies that are very effective.
No, of course. Have you come across many people with Tourette's syndrome at all?
I tend to not see that many. I tend to see a lot more young people with ADHD and autism. And that's probably because those young people with Tourette's would probably go to more specialist services. And so to have that treatment. But in my practice, it tends to be a lot more autism and ADHD.
Right, okay. We're just going to another quick ad break and we'll be right back.
UK Health Radio, the station that makes you feel good. UK Health Radio, the station that makes you feel good.
So, the importance of diagnosis. Tell us a bit more about how important it is to diagnose people with the variety of neurodiversity conditions.
So there's something that happens, psychiatry is very different from other health conditions, that there's sort of no blood test or, there's no CT scan that gives you the diagnosis. And so the way that psychiatry works is that you're interviewing the individual, you're getting collateral history from perhaps parents or the school, and you're looking for clusters of symptoms. And so something like ADHD, you're looking for inattention, impulsivity, and hyperactivity to make the diagnosis. And so you're wanting lots and lots of examples of that. And then from that, you can think, what the best treatment is. And normally, clinicians would use something like NICE guidance to dictate what their treatment plan would be, because there have been lots of research and it's all been analysed to see what's the best approach. So you'd never say to someone, perhaps, with a physical condition, that we're not going to give you a diagnosis. We're just going to, say that we're just going to understand how this is affecting you. And so in a sense, that's my rationale for thinking that a diagnosis is essential, because then you can think about your treatment plan carefully.
I know you've mentioned about, the treatment for Tourette's. I mean, talking generally, is there medicinal treatment as well as a worst case scenario for any neurodiversity conditions?
Yeah, so you can use medication. So it depends on the severity. So something like ADHD, if the child was having difficulty in school, you'd probably want to do school liaison, think about very practical ways that they could be helped in the classroom, think about adjustments. If they're having problems at home, you might want to think about parent training and think about how they react to the young person's behaviour. But then if the symptoms are so severe that those interactions don't work, and something like also individual therapy with the young person, then the next step would be medication. And so you might think about stimulants or non-stimulants, which would be used to ameliorate those symptoms. With something like autism, there's no medication to treat that disorder. But lots of young people with autism might have other conditions that are amenable to treatment by medication, such as severe anxiety, severe depression, OCD, things like that. But it always comes down to severity, because you're thinking about a cost-benefit analysis. So in an ideal world, you'd want the young person to have an approved treatment such as cognitive behavioral therapy for something like depression. And then if that wasn't working, perhaps after 6 to 8 sessions, then you might think, well, let's add in some medication, because that will improve the outcomes of having both treatments, as it were.
No, of course. I was asking because, I suppose people would try using methods, obviously taking us away from medication, because it's always like a last resort. So, but I thought maybe in worst case scenario, obviously if that doesn't work, it sounds like medication is the best way forwards. Is that right?
So it's very simple in adults, because you have informed consent and you make a decision, and so I might say to you, would you like therapy or would you like medication? And these are the benefits, the negatives. Both of those, and you would make an informed child. You've got to think about the parents, you've got to think about the impact on the young person in terms of perhaps taking medication at school, things like that. And so it becomes a bit more complicated. But essentially, it's the same approach. You're thinking what would be best for this individual. And so for some individuals, combined treatment might be the best approach, but for others, psychological treatment. So it really is about what the young person's presenting with and giving them those options.
No, of course. Let's talk about neurodiversity in the workplace, so involving adults, etc. Talk to us about what you've heard, what the challenges are, and that kind of thing.
So it's becoming that, because we've got, in a sense, this workforce shortage at the moment. I think workplaces are evolving to think, can we get the best out of our workforce? So the idea that we're all neurodiverse and we work in different ways, I think workplaces now are a lot more engaged in considering how to get the most productivity, how to get the most job satisfaction. And so they're looking, not just at those with neurodiverse conditions, but they're looking at, their workforce as a whole and thinking, the things that we can do that will improve the workplace, and that will improve retention, that will improve productivity, that will improve staff well-being. And so I think in terms of neurodiverse conditions, workplaces are understanding that there are specific benefits to some of these conditions. And so people with ADHD tend to be very creative, tend to, have high energy, perhaps have, different perspectives. They're able to make connections between things. They really are ideas people. And so to have those individuals in your workforce can bring great benefit. And it's the same with autism, that there's benefits to that condition potentially in very specific areas, such as attention to detail, ability to analyze things, and all those types of benefits. And so workforces, probably in a very, are wanting to maintain their workforce, but they're also wanting to, in a sense, bring in talent that will benefit the organisation as a whole, and now are looking towards the neurodiverse conditions, neurodiversity, as a way of dealing with that.
You reminded me of, when you were mentioning autism, there was in the 80s, they used to show him on TV a lot. I'm sure you know who I'm talking about, a young child, and he could draw anything from memory.
Yeah,
he could draw anything, and it was unbelievable. And now he's an adult, and they'll still show him on TV. I can't remember his name. And I just thought, that's amazing, to be able to have that kind of skill. And another person, I knew someone that had autism years ago, used to work with them. They were able to take puzzles that were like, the 1,000-bit puzzles, and just put it together with no issue. It's quite amazing.
So I don't know. I don't think that's the general, but you do find.
No, I'm not saying that.
Yeah. But you do find that individuals will have specific skills that can be very, very beneficial to them, and so I think it's that idea that we're all different and there isn't one right way, but by opening up our sort of curiosity and minds to these different ways of interacting with the world, it's very interesting, and there are potential benefits.
100%. Do you think there's any differences between men and women when it comes to neurodiversity and the symptoms and characteristics?
So there's a lot of discussion that the typical young person with ADHD is a disruptive boy with high energy, and there's sort of discussions that that idea of being on the spectrum is more male than female. But more and more as we're understanding more about these conditions, it's that it's just that females will potentially present in different ways, and so they are maybe much better at masking their difficulties than boys potentially. But there does seem to be less issues with hyperactivity in females. It's more about inattention and less obvious. It's sort of more subtle, the signs of autism in females.
And in terms of age groups, like comparing the youngsters to adults, do you find that, I suppose it depends on how they were supported, but do you find the person's able to manage the conditions better as they get older?
So I think so. So in terms of ADHD, probably lots of young people will grow out of their difficulties, as it were. They'll learn ways of managing them. But probably about a third of those children diagnosed will still have difficulties in adulthood. And that tends to be more inattention than hyperactivity. And with things like autism, I think depends very much on their development over time and where they sort of were starting in a sense. But essentially, the same as all of us, you learn workarounds, you learn ways of dealing with situations, and so you hope with appropriate support and treatment that you've been able to master lots of ways of managing, things that perhaps caused you difficulty as a younger child.
Do you have any examples of working with children that have maybe Tourette's or autism or ADHD, and how they were brought through the service and how things improved for them at all?
I'd say lots of the young people I get referred, it's at points of transition. And so it might be like moving school or, going to university. So it's at times when life becomes more complicated. And so generally having a diagnosis means that you can really formulate where the problems are. And so you can work with the school, you can work with parents, and so that they can understand, what the difficulties are and think of ways to problem solve those and work with them. But essentially, it's a very positive thing having a diagnosis. I mean, if you've been wondering that you feel different and things happen to you in your life because, the way you interact with the world and with others, to suddenly have a better understanding of yourself, as part of your identity, I think it's a very positive thing. So normally it sort of leads, initially there might be, a grief response in a way, especially from the parents, and while they try and understand what this might mean for their child. But essentially, it's a very positive thing, because then you're able to research the condition, understand more things, get support, and so things do then move forward.
Do life experiences exacerbate the conditions at all?
Gosh, I mean, we're all affected by the world around us, and so it's one of those things that if you, in a sense, have a vulnerability, that you have difficulty making friends, and then perhaps lose your best friend, that will be a huge life event. Whereas if you are very extrovert, have no difficulty making friends, and you've got 12 friends, and then one decides that they don't like you, then you can cope with that, a lot better on an individual basis. And so the same as anyone, that if negative things happen to you, if you don't have lots of things that, in a sense, bring you joy in your life, like lots of different areas, then you're going to make yourself more vulnerable if you're just reliant on one thing. So the typical for doctors is just being a workaholic, and then, they lose, if something happens that they can't work and their whole identity is work, then that is a huge, deficit. And then, they have to realign that, their whole life. Whereas an individual that perhaps is more balanced and, has their job, has a family, has other activities such as being a radio host, and then has some sports, then, the more balance you have in your life, the better. But what I'd say with, young people with neurodiverse conditions is potentially they have to work quite hard to have that balance, because the conditions themselves perhaps narrow the focus. But once they have the diagnosis, I tend to find that it really galvanizes, young people. It allows them to think, gosh, so this is what I've got to do to be happy. This is, because up to that point, you can have a lot of time that they're just trying to be like everybody else. And they're perhaps asking, and they're not understanding why they don't enjoy the same things. And so it can be very liberating.
No, absolutely sounds it. It sounds like they have to almost do a lot of self-talk as well to kind of, reflect, and in order to move forwards, knowing that they might think about things differently to other people due to the condition. So they have to kind of rewire the way they think about things as well. Would that be right?
It's hard. I wouldn't say it's like that. I think it's more about them accepting that it's okay to think differently about things. It's okay to, in terms of relationships, it's okay to think about quality rather than quantity, and perhaps have fewer relationships, but make sure that those have meaning. And it's okay to find relationships difficult. And once you have that awareness, you can put structures in place, as it were, and you can problem solve to think about, what you're going to do to enjoy, things as much as possible. So,
talking generally about, have you got any projects in place for the future at all this year?
Gosh, so in terms of myself, I'm sort of wanting to write more and more. I've got a book.
I was going to ask you. I was suspecting there'd be a book somewhere. That's why I thought, let me just ask if there's anything been planned.
It's not about neurodiversity though. It's about inquests. It's a medico-legal book. So.
Oh gosh, that sounds.
It's something completely different. A bit more academic than clinical.
Sounds quite complex. Have you thought about writing a book around neurodiversity at all?
Gosh, I really feel I'm at the start of my journey. And even though I've been doing neurodiversity for 15 years, it really feels like everything is changing. Like we're on like this gosh, I suppose like a jet rocket or something that suddenly, it really has become prominent. And I think over the next 5 years, we're going to move forward in leaps and bounds. So I would say I'm not at the point where I could really put my understanding and everything I know about it into something completely coherent. I'm on the same journey as lots of my patients, as lots of the families at schools. But it's a very exciting time for neurodiversity. So who knows, like in the future, maybe.
Brilliant. Thank you so much for coming on the show, Dr. Pendlebury. Always a pleasure. Tell us where people can find you if they just want to maybe ask some questions or they have some queries, anything like that.
So I'm on Twitter, or if you just Google Dr. Gabrielle Pendlebury, I'll come up, and I'm happy to answer any questions. So please get in touch. I apologise if I've not been completely accurate, but as I said, I'm learning with you. So please tell me if I misstepped anywhere.
No, I think the information is always going to be useful, around neurodiversity and everything else, But thank you for your time today. Much appreciate it.
Thank you very much.
And thank you to our listeners. You can find me on Instagram at GavinJ417. Until next time, take care.